what we do in exposure is have people confront their fears.
What's your anxiety level now?
With virtual reality therapy, we can have people confront their fears in a manner that we can easily control. Also have them confront them in a way that's better than just thinking about them, because we use both audio, video, and in some cases we can even use olfactory stimulation in order to really simulate the environment and what it is they're afraid of.
What if a plane was hit? What if it's going down? What's going on?
The idea is that we use what's called systematic desensitization, or a hierarchy. We have people do this gradually, so we don't suddenly just have the plane in midair with lightning and thunder. We take them through each step, and only when they become comfortable with that particular step do we then move on to the next step.
Landing gear is going up. You're now in the air. The bell lets you know that you're through 10,000 feet.
These are treatments that are not very long in length. About 12 to 15 sessions is usually all that's required. The sessions usually run between 60 and 90 minutes, depending on the person's level of anxiety. So it's not only a very effective treatment, it's also a short-term treatment. Now, what we would do with her, in addition to the virtual reality, is we would give her assignments to practice in real life. So, for example, once she felt comfortable in the virtual reality terminal, we might have her go to the real terminal at the airport and stay there. Then we might have her watch some planes take off at the airport. Eventually, we would ask her to take a flight, a short flight, so that she could then get comfortable with actually doing it. But we only do those things after we do the virtual reality. So we combine in the behavior therapy the virtual reality therapy with actual, what we call exposure and homework assignments that people do on their own.
The ground is coming up to meet you.
We think of it as new learning that overcomes the old learning. So we know that very definitely there are changes going on in brains, in the memory area of the brain, and that people are setting down new pathways, new learning experiences, and they are learning not to be afraid in these very specific situations.
Plane is taking off. You can feel the plane begin to take off. You feel your chair is rumbling.
So virtual reality is now being used to treat many anxiety disorders. Specific phobias, social phobias, post-traumatic stress disorders are the most common.